I'm old-fashioned, you know. When somebody touched my teacher, come to the ring. 2 hours. Bam, 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 bam. He wiped the floor, but that was real. That was real punch.
We call this samurai complex.
Inner pride. You want to press me? I'll show you. I learned the best Aikido. Blood problems, lots of neural entrapments, and lots of neural problems, lots of biomechanical problems. Or I can solve this. 7 minutes to solve your back pain. And I saw the test, I saw the EMG. I love this, and I make this, like this. Idiot. The best book ever written. Look at this. Intravertebral probes. That's wrong. Wake up! Wake up! Where's your focus? You're yelling at me. Oh, that's just beginning. Hello, guys.
Hello.
Yeah, cheers.
First things first.
Cheers.
First things first. Cheers.
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 Salute.
So, Doctor, thank you so much for having us here. You have a versatile wealth of experience. You are an accomplished martial artist, an ex-military special forces, a Ph.D., kinesiologist, biomechanist, and the proprietor...
So many things in one person. That's impossible in one life.
Yeah. And of course, the proprietor of Athos Academia in Novi Sad. Please tell us about your non-conventional entry into this profession, and perhaps tell us about how martial arts and kinesiology follow similar principles. Maybe you can give us a short synopsis of your life, history, and education.
Well, how this thing started, I first studied mechanical engineering. A long time ago, I had a problem with the back, like everybody else. You know, I was in a sailing team. And I remember we had a football match and I missed the ball. So I kicked the air and I feel terrible pain in the back. And I said terrible, it was pretty much sharp, I couldn't move, etc. But anyway, then I entered the faculty for mechanical engineering. And it was everything good except that I studied something that I didn't like. Some kind of industrial engineering. I wanted to be an airplane constructor. So, yeah. That's why, in rocket, especially the rockets, that's why this shaft here is in the shape of the rockets. That's,
And the airplane.
And the airplane, yeah, exactly. It started like this, and in the meantime, I start to run the also application for the kinesiology. So I found this somehow mutual, because I wanted always to work with people. And then I realized the mechanic engineer, but it's not going to be that which will make me happy. I put my smile on my face all the time. And at that time, I get first sciatica, nice one. My small toe becomes very numb. I went to doctor, a neurosurgeon, and he said, okay, what do you study? I said, mechanical engineering. Stop, don't do that. And it was, no, that's, here we still have this Austro-Hungarian respect to the professors.
Yeah.
We cannot call them like in Canada. I see that. Hey, for instance, let's say people call Richard Wells, who is I know, is emeritus professor like Stuart McGill, and etc. You cannot call your professor by the name, or professor, or doctor, whatever. Must be respect. And he said, just make long story short, stop this. You have sciatica. Who can be better than you? You know the pain, you know the science, you know the suffering you passed. This is what you're studying. I was asking, you're not fitting that story. Mechanical engineering, that's you like, airspeed, will go to capital city, Belgrade, and you're probably a waste of time. And he was right. I go there, applied, quit mechanical engineering. Actually, I get from mechanical engineering anything I need for the kinesiology stuff and for the spine stuff. So it's statics, dynamics, thermodynamics, dynamics of fluids, and etc. So that's what I need. Then I applied for kinesiology, 4 years, and magisterium, 2 years, and Ph.D., 5 years. And that's the role I run. Then, since I have a back problem, I worked 10 years in Sport Medical Center. And I deal with a back pain guy, but there was one very older Reagan system for a back. And I thought, doesn't work, somewhere it works. What's the problem? Seriously, what's the problem? That makes me annoying because I had a pain. Some guys I help, I cannot help myself, something's wrong. Somewhere is a problem, you know. Somebody says yes, somebody says no, okay, good. And then I start to read papers. At that time, We didn't have internet. You should go to library. So then I started to read, and it was 1991. I met first paper from Dr. McGill. And that was like a, illumination, like a punch in the face. And I started to follow, but no internet, you have to wait something that somebody printed, and you call your phone, this kind of phone, di. So that's actually how I started. In the meantime, I was also involved in Aikido, and this martial art, actually, Aikido use a lot of sword activities. Sword actually give you focus and control, so that you can control your emotions, that you can control the motion, emotion, posture. So that was actually something that really changed me. In the past, I was a not successful kickboxer. Everybody kicked my ass. Sorry for expression. So no. Then I realized I'm very good in defense. And then I realized this in table tennis when I played. I'm not good as an attacker.
Counter.
I play a very good defense. So actually that changed me. And my mother, my grandfather, and my grandmother, they gave me other kind of influence. To be just who you are. Don't pretend that you're somebody else. And my grandmother also turned me toward faith. That's another part that I really deeply respect, faith. Faith and science go very well.
This is great so far because I feel in some ways we're very parallel, obviously.
Yeah.
I'm also coming from martial arts background, and I actually studied CNC design and manufacturing. So I recall at one point, one of the things that caught my attention was you talking about the X, Y, and Z vectors being the same in both martial arts and biomechanics. Can you expand on this thought a little bit? How has your martial arts influenced your training with the spine specifically, and your perspective on it?
Yeah, right question in the right moment. Aikido is very dynamic. And what is the problem by today Aikido? People use more different parts of the body instead of hips and shoulders and knees and ankles. So they bend too much spine, so they twist too much spine. I'm not saying that's good or bad. Actually, that's not efficient. We should use some other movements from other martial arts. And then I realized I have to stabilize my body if I want to throw somebody. If I bend myself, I'm less efficient. So I put this in calculus, in engineering way. Wait, this is like the huge crane. And it's being, instead of I rotate, I bend this part now. It will collapse and it become efficient. There is one very nice term in mechanical engineering, coefficient of efficiency. The more stable you are, your coefficient goes high. The more bend yourself, you train, your coefficient goes down. What is your efficiency? In this position, pretty much low. In this, high. And then you can do whatever you like, strike, punch, block, and everything else. Of course, you cannot be robotized as people think. You bend your spine, you twist your spine, but everything in the right moment with the right direction. Now there comes another question. You're not so perfect. No, I'm not. I ruined my backs, I ruined my shoulder, I ruined my knee in my sport career, of course. I paid the price. But paying that kind of price, I realized today in sport, we can change many things. So the penalty of the body is pretty much minimal, and the results will be more efficient. The martial arts actually give you this.
I've heard you say previously that slow and precise training makes one fast and powerful.
Yeah.
Can you expand on this idea a little bit?
No problem.
Seems
Absolutely.
counterintuitive for some people.
Yeah, because people think if I practice fast blow, I'll be fast. No, you will make yourself slower. Make it slow, full concentration. You know exactly when to squeeze, when to relax. Then you get fast, and then you practice this. Dr. McGill explained this very, very nicely. That rates between contraction and decontraction is essential.
Rate of relaxation.
Yeah, rate of relaxation. And the other thing is when you focus on very something precise, people think, oh, we have to build our muscles. No, you have to build all our body as a one muscle.
Talking about a system.
Kinetic linkage.
It's beyond that term, so I'd like to avoid this because when you say kinetic change, notice that people, I mean, that it's misguided, like core exercise. Okay, we'll come back to that. When you practice very slow, with mild amount of the tension, that tension goes up, up, up every time. And then you make this, it goes very fast. Why? Because you come here. If you make, especially when people use the weight in the hands and start to do this, oh, come on. That's a problem.
That's misdirected, yeah.
That's a huge problem.
It's a huge lever.
Yeah. Other thing is the number of repetition. Number of repetition defines, are you in the level of speed, are you level of full power, strength, or endurance?
Right.
If you go above 5, you're done. As Pavel Tsatsouline, Master of Science, is fantastic. He is really fantastic. This is that kind of Soviet old school. If you go above 5 reps, you're doing something else. That's kind of already of bodybuilding. Because the real strength are somewhere between 3 reps. But also the power, but also the speed. And the people need to know exactly, you know, Matveyev, Professor Matveyev, a long time ago says, is a Russian, very high respected specialist for trainings. Train maximum, train often. And everybody hear that. But the third one, which is the third one,
or
which,
too much, too
yeah,
often.
no, you can do this. Trust me. One maximum punch, perfect, good, no problem. But let me finish. When you're fully relaxed, when you're fully fresh,
Fully recovered.
nobody wants to hear that. And that's what's happening in, let's say, CrossFit is beautiful. It changed every single thing. Boring fitness, that's actually very bad fake copy of bodybuilding, because bodybuilding is a huge science. You have to respect or disrespect, you have to honor it. Okay. So that's the problem. People don't understand. You can practice 10 times in a day, 1 rep, but that rep is 1 maximum rep. But the amount of the time between those 2 reps, it's crucial. That's the important part.
So what is the ideal amount of time?
That's a nice question, but it's individual for everybody. Here is why. In Monday, when you train Monday, and you give 100%, perfect. Then comes Tuesday, you got 100% of the problem of Monday and Tuesday is that Tuesday is Tuesday plus Monday training.
Right.
So coming Friday, you have all those 4 days before and added here. And the periodization for that is essential. I know that some people, very famous, said periodization is not so important. Well, it is.
So the answer is it depends. I think
Yeah.
what could be a practical tip for an individual to kind of understand where it is they are. So whether, because a lot of factors can play into life, and a person may have a written schedule of what they're going to do within this week. So when a person wakes up on a certain day, how do they know whether they should push today or whether they should back off?
Okay, first of all, you need to put things in context of the person. First, you need to test the person to see really his ability or her ability and what's the schedule during the day and the week. So here's the tip. When I work with a client, I work with the back guys, usually. Sometimes other injuries, but back's my area, my backyard. I never allow them that they go to be fatigued above 60%. Never. Stop. 40%, keep in the bank. That's your savings for tomorrow. Why? You have, let's say, look at this. Exactly, nice example. They're now, let's say, balanced. And this is now the glass full of energy for your physical activity. So when I drain this and I leave maybe 1 finger down, this is energy for mental and for basal metabolism. So system has to be in balance. So this guy gives here energy and this guy gives here energy. The system is balanced like this. And instead of 100%, that system is full, you have another problem. This guy gives 70% or fully top out from the training like this. And after that, he's not able even to drink a water. or to eat something. Neither I'm speaking about job or even enjoying special moments, having sex with your beloved wife. So you actually killed even this system and that system, and you're able to do nothing. You just go home and vegetate like a plant. You see, this is how people tap out yourself. And tomorrow come this most stupidest motto: no pain, no gain. Well, no pain, no gain. That means good, my friend. In 10 years, you're no pain, yes. Now you have a pain and you're crippled, you're an invalid. Because you tap off yourself, you kill yourself. Oh, I'm good, I'm good. Ask, for instance, now, fortunately, I love CrossFit. But how many people are now injured in CrossFit? Why? Because they crossed the line.
Yes.
That's the problem. And then, instead of no pain, no gain, it's better to say no effort, no results.
Right. You know, these are semantics. Sometimes I feel like these comments can be misguided in that maybe what was originally meant was just muscle burn within good form. But then people can't differentiate sometimes between nerve pain or joint pain or muscle pain. So in some context it may be valid, but it gets misconstrued.
Yeah, especially nerve pain. Well, that nerve pain is pretty much, when you have a nerve pain, you know what is nerve pain. Especially when you have a pain into your tooth. That's a nerve pain. That's a nerve pain. And I remember when I had pain here, I wanted to hit with my head in the wall. How they so high pain.
Is there another measure for an individual to pay attention to other than just pain?
Yeah.
To understand whether
Yeah.
they have 40% left in the tank,
absolutely.
which is suggested, or less?
Nice question. Yes, there is. There is two. Very simple. I said this to everyone, and I think the last 10 years, now people start to recollect. So, 0, 10. It's a Borg scale, but it's inverted. 0 means you're perfect, you're good.
Yeah.
10 means you're totally tap out, you're totally drained out. When you reach 60% of your fatigue state, stop it. Why? Because this is still trained in emotion. When you sit on a chair, you want to get up, that 6 will be not 6, probably maybe 7, maybe even 80% of your tap out. You have to leave something behind, energy for something else. That's first thing. So, here's the story. Squeeze the fist or squeeze the arms and full body. You can squeeze it 100%, perfect, good. If you can, I squeeze, but it's not. Then squeeze just fist. Is it 100%? No. Then you squeeze. No. That means that day, no some swings, no kettlebells.
Yeah.
Practice training. Practice technique. Use lightweight. Place yourself like this. Practice technique. Practice breathing. No squeezing. Focus yourself with this, okay?
So the most fundamental thing.
Absolutely.
And do less.
You'll be shocked when someone told me that when they asked one Denis Denisov, who is a Kettlebell champion, yes, what is the weight that he's practiced? I think he said 12 or 16 kilo. I think even 12 kilo. And he is working 2 times 38 long cycle. See? So you purify your technique. When slowly repeat, come down. And this is also the training. Here maybe it's 40% effort, even less. But you put then focus and control to your body back.
Sure.
And this is also the process that you regain the energy.
If a person wants to understand whether they're at close to their breaking point or not, they should step back and do something very fundamental.
Or just lay down and breathe.
And see if they have trouble laying down breathing or lifting the very light weight over their head. And see if
doesn't
they
have to be
struggle.
overhead. You practice something. Just
Something
control.
that should be
practice
easy.
technique with plastic stick, with wooden stick. You want to do this? Good.
And then my last question regarding this topic is, I have a feeling there will be a difference with a person's ability to judge where it is that they are based on their sex or even their where they grew up. So let's just leave it on the sexes. Are women or men better at understanding?
Well, from my point of view, women are always better.
Always better.
Always better here because she's focused. She knows that she's weak with the strength. So she used the brain to come to precise technique. And now in triathlon, when I was national coach a long time ago, women's makes better results than boys. Let me finish one thing about that squeeze. Just not forget. This is mostly for upper body. Buy some dynamometer. You can buy on everywhere. 25 bucks. Make it squeeze maximum, make it squeeze maximum. Measure it. And when you lose 5-7 kilos less, that day you do something else. That's for the upper part. Lower part, one leg stand. So you have one leg stand. And then you go like this, lift. If your foot is very stable, not like this, you're good. You're good. Now you go. Practice. But if your foot start to dance, then your knee start to also swing. Arms, legs, core. Not this, sorry. This is core. And that's what people need to understand. Practice every day, full body, some exercises that you like it. And get lightly sweat and never get fatigue. I'm speaking for those who are involved in recreation. If you speak about CrossFit, that's another kind of story. Here, many systems for recovery must be included.
This actually reminds me of a conversation I had with Edward Cohen while doing a workshop with him. How is it that he lasted so long in his career and healthy, relatively? And he said to me, because I don't lift heavy. And I said, Ed, you're one of the greatest powerlifters of all time. How is that you don't lift heavy? When do you periodize heavy lifting?
That day of competition.
He says to me, I lift heavy twice a year. Once at the Worlds, once at the Nationals.
Finished.
That's it. And so the weight seems to be something to stimulate our nervous system. And his point was that you can do that without extra load, as long as you are locked into what you're doing.
We need to have also, for us, 2 times in a year that we test ourselves to measure our progress or our regress. So you have up or down. And you know, and with the age, usually science says by the age your strength goes down. If you're clever like everybody else, those guys like this, your strength goes slowly always up, very slowly. So they don't add so much progressions in training. And about that, that's another topic we can talk. When to change load, when to change intensity, and how to increase volume, or when to decrease volume. So we're speaking about training stuff. The same methodology I use for back pain guys, because I treat them as a high top athlete. And that's why we have, if I may say so, such a nice, good results. I treat them not as a crippled people. I mentally prepare them to make world record. World record for them will be no pain, better motion, better control for the body, and to continue to last as much as they can, because everybody now everybody. You can remove the pain from the back or from there very fastly. But that's the first part of stage. And you said, I don't have any more pain, I go back to Pilates. I said, wow. Now, 3 months I work with you to make ideal posture for you, to make ideal circumstances for you. Okay? Your pain is now minimal, that means between 0 and 1, or 0.1, 0.2. That means the nerve is still in problem. Doesn't have to be pinched, but still is inflamed. Give yourselves half a year more to see what's going to be. And then if another 3 months after that, so it's a year. What is 1 year compared to whole life no pain?
For now, we are still in a time where people have problems, and then they ask themselves the question, what should I do? And there is a part of the population that will be looking for an approach that is passive, meaning they're going to receive something from someone, and as a chiropractor, I see this as a passive approach. Somebody comes and they tell me their story. I do what it is that I do an examination, and then some hands-on therapy. Osteopaths, other manual therapists also do this. And then there is something like exercise or changing habits. This is a more active approach where the individual must create change or within their everyday life and put in the effort. This is going to cost them energy. And the question is, when should a person choose a passive approach and when should a person choose an active approach?
Yeah, well, we'll come to the question. It's when fatigue state is after 6, then you use the passive things, okay? But in the first part, take an active things. Well, passive and active, it's like one coin with 2 sides. Here's active, here's passive. Here's the center. This is now in balance. Tell me if I grab it here, is the system in balance?
It's in balance, but you're having to work harder in order to maintain the balance.
Absolutely. So here is 60% that you lost energy on your training. Those 40% is a passive approach to training. It's a mental attitude. Shut up. Focus on your energy. Keep your energy down. Or go with friends. Get some laugh. Enjoy moments. Recover yourself faster instead of going home, take your best friend, remote control, and change the channel. You understand? It's a very nice question. So also, relaxing is passive treatment. And sometimes this passive treatment is also the same way efficient as active.
One of my questions was exactly about the word Athos.
Yes.
Athos Academia. So where is this coming from? Please expand on this.
Wow. Athos is a peninsula, a very small peninsula in Greece, in Halkidiki region, North Macedonia. And today is 20 very old monasteries active there. There live monks. This is monk republic, with Karaia as a capital city. No female foot stood under that ground for 1,000 years. In the past, few exceptions were made. For our king, Sardushan, when he came with his wife, but the wife was carried.
So she couldn't stand up.
No, she couldn't. No, that's a really strict rule.
Oh, the patriarchy.
No, because at that time was huge plague in this area, in all Europe, and he wants to save the family and later ancestors that will come, and even future kids will come. So that was this, because that peninsula belongs to the Holy Mother, because she stood there, and now all of those monasteries celebrate Holy Mother as a person that is in charge for every monastery. So only one woman can be there. She a pure woman, Holy Mother. No other woman can be there. And the people live there, they pray to God, pray to Holy Mother, purify themselves and pray for the whole world. You don't know that. They pray for the whole world. And we spend there now and going next week. Again, because you're not going back, you're coming back home, because Hinandari for us is something very highly sacred. So you go there. Next time you come, I will take you to Greece. No. These, when you enter these doors, you're entering in the 11th or 12th century. When you sit in dining room, the monk on some special part of the kind of hill, he is reading the Bible during lunch. And then you hear sound like this. Now the wine is blessed. You can take the wine, no problem. Now it's finished. Then you go outside, and the whole monks standing like in a shalom, and they bow to you, respect your visit. The other who served you, he bend yourself down to the ground. He begging for not to be hard on him, if something was very wrong during the services. The other, standing like this and baptize all you and wish you all the well. It's, in one word, beautiful. And at the same time, insane. Why? Because you're there. You don't want to leave that place. It's something that you realize you're in a place where you become, clean all your toxic things from yourself, mentally, physical, whatever. And then you come back to this kind of environment and you realize, oh my goodness, I live in hell. To be a monk is dedicated training. Trust me, it's not easy. Wake up. They wake up at 1 o'clock in the morning till 2, read, pray, and get up at 4, all together read with them, till 7, praying non-stop. Then you have, at 8, you have a lunch. Because the praying was a breakfast, and you have a lunch. Then you go do some other duties, and then you go noon, about 1.5, depends on the day. Then you, at 2 o'clock, you have a lunch, dinner, sorry, and no food, no meal after that. And from 6 to 8:30 or 9, again praying, and then you go to bed. Sometimes when Christmas, the midnight Christmas, midnight praying started exactly at midnight, end up at 9 o'clock in the morning. So you stand 9 hours and pray. And after that, you're not anymore the same, in positive way. So this almost the same is my approach here to clients. Seriously. No, they come, I see pain. It's not only a pain, it's something different they have in the body, also mine. So if you fix the back pain, you didn't fix the whole person. The back pain will come back again. They have to think about posture, correction. Take time out what is necessary. Don't be plastic. Be who you are and accept yourself with these things. And when you have right approach, that's totally different. I'm really top out of the trainings. I said trainings. And these are not my clients, these are not patients, my students. I teach them something new in life. So this is the way I use this kind of approach. Monks, praying, said, close your eyes when you do exercise. What? Close your eyes. If you need to do some praying, Holy God, Holy Mother, whatever, do it before exercise. Why? It will put you down, calm. Then when I said, put a fist, make this, make the shoulder blades, pull the shoulder blade. Oh, I feel it now. Now you do. That's why you come slowly. That whole body become one muscle. After, speed, strength, power, very easy. But if you do it like this, you don't understand what you're doing. You just realize that you lift your head. Sorry, then you can put your finger in your nose. Perfect, good. Yeah. Dig it. Why? Maybe you learn something from it. Sometimes you have to slap him with some primitivism approach and then start to laugh. This is a very important part. People come to you and ask him, what is your pain? Oh, 8, 9, 10. Good. Then I make some jokes. Or make some tricks. They start to laugh. I said, what's your pain now? Oh, about 5. Nice. You came here with 8, now 5. So tell me what is real. Let me close your eyes. And you see that you're having pain. Okay. It's about 4, 4.5. Yes. Okay, good. Take this position now. Why? Because in this position, I'll test you and I'll see if this position will relieve your pain because I see the way you get up, get in. That's the way. When they open the door, that's what Miguel says. The moment they open the door, observe how they move, how they go on the stairs, how they move the body, where is the head position, where is the chest, how they use their arms. So we test, exactly. We test gait parameters, we test spine parameters and dynamics, statics. We use many different tools, which are quite expensive for testings. More than $120,000 we invest in our lab for testing tool. But you know what? Look at your fingers, your eyes, zero investment, and even this, squeeze it.
A lifetime of investment.
Yeah, exactly.
It's different currency.
Yeah, but the thing is, I adore science. I really adore clinical science. Not science for the science, clinical science, that's beautiful. when you learn from these people. And the most important part here is also listen to them. If they need to speak 2 hours, let them speak 2 hours. Why? He will tell you the whole story, and you just realize that they told you what is solution.
Mm-hmm. Yeah.
3 exercises. You know the big 3 exercises? Mm-hmm. Brilliant. Brilliant. That's a brilliant. What Stephen Gill have done this? Brilliant. But you know, it doesn't work in hard patients. And people think that, no, she explained. This is something that people should do every single day. Mm-hmm. But for serious back pain, a serious sciatica, SI joints, it doesn't work. So I decomposite all these things. To come to this very slowly, to dismantle body and to reduce inflammation. You should work them every single day. For all those happy people, but don't listen Dr. Google. If you listen Dr. Google, you can die from a grammatical error.
I'm trying to think of things that I can ask practical that people can apply to help them move along.
Yeah.
And when they are in pain, when there is a herniated disc, when inflammation is high, a person must be taught how we describe. They also describe this certain level of rigidity.
Yeah.
It is protective. It is something that I'm going to ask you to expand on. At what point does that person wean themselves off of the rigidity so that they are not so robotic?
Yeah, so many
and
questions.
How do they retain some of it to be beneficial but not look like a robot in their everyday life?
Yeah, well,
That's a
that's
good question. There's a very common critique that we get of the BackFit.
Yeah, no, I've seen that. One guy make this on Instagram, like people get up like this, like robot, and make fun of it. If this gentleman really have some common sense and really honest heart, he will never make this. Mm-hmm. That's first. And I feel sorry for this.
Don't waste time on that.
No, I'm not wasting time. Just want to make my own statement about that. So I will feel sorry for those people. And may the God really help them to find the solution. First, the BackFitPro. BackFitPro, actually Stu, what he embodied. It's very helpful. It's very helpful for people, especially the back mechanic. But in book he wrote, back mechanics is very good. That it really drives you how to test yourself in the beginning, and also how to approach yourself when you have these special conditions. That's one thing. Second thing is that with his approach, you can really find the answers on many back pain issues. Seriously. What I've done, I've just dismantled side bridge, bird dog, and up curl, and make other variations for very specific topics so that people don't experiment, so they can go directly to their solution, which always have. It depends. If you have this, then you can do this. But the back pain is, you know by yourself, that's terrible pathology. It's not so simple. Lots of edema inside, lots of blood problems, lots of neural entrapments, and lots of neural problems, lots of biomechanical problems in the nerve, in the blood vessels, in ligaments, but also in the disc, in the vertebral body. How can we solve the cause? That's the steward pointed the finger. How to solve the cause. I knew anytime I go see seminar, he used the same test, same, but it's not the same, because sometimes leg is up to this level, sometimes leg is up to this level and twisted a bit, sometimes leg is here, but more tested to make subclustering inside of the body. Mm-hmm. You know, sciatica is a one name.
Tell me about the rigidity.
Yeah, well,
what does it do, and at what point throughout a person's recovery can they expect not to have to act like a robot?
Here is what people do here in Serbia. When somebody gets spasm and gets rigid, such work, they visit guys like you. Mm-hmm. And those guys make no more rigidity, no more spasm. Oh, I feel loosey, I feel good. But what happened actually, really? People doesn't know. So this spasm is a very protective mechanism, the most expensive software you get from your body. That means there's something wrong inside. And then we call this Mr. Bone collector. He do this, okay? Because he doesn't care about real things. He never tested. I have spasm here. Okay, lay down. I'm not speaking bad about chiropractors.
Sure.
No, I'm speaking about a certain person who are practicing chiropractic technique, and maybe they are not even chiropractors. They're also natural-born chiropractors. That exist here in high level of percentage. And now everybody can think they can be chiropractor. And you know how this is not easy to fulfill all the task you need to do in your faculty. So when you make this manipulation, I saw so many chiropractors that actually not cracking. They're doing very soft manipulation, and things go in fantastic order. And these are masters of the craft. And this guy lay down and crack like a branch. Something wrong. Something is wrong here. Here's why. The muscle is in spasm, and you release that. You remain like that. And what's happening? Spasm is now above limit of brain radar. So realize something is wrong, something is stable, whatever is happening there in the spine, get in the spasm. Why? This is protective first measure that things stop moving and you get rigid. And you know this when your pain comes to you. They're blocked, not even waving their hands, okay, and arms. So the other thing is, people manipulate this, and then these muscles, oh, now it's softer. No, it become more deactive and deactive. Here's the activation, because you go from very high activation to down, and then suddenly they're off the radar of the muscle. When you see the MRIs later, you see there's a fatty tissue infiltration. Surgeons like to say they're not fatty tissue infiltration, they're muscles that are shut off. So muscle cannot become fat tissue. Fat tissue, perfect, good. Give me the knife, I will put it on the bread and I eat it. It's not like that, because they lost my theories, lost my mitochondria, so they become inactive. Reversible,
Yeah.
has to be exercise, but it will take time. It will not come overnight, and depends of injury and how long the TV was off and battery was off, the charging depends. Will be able to recover this or not. So that's one problem by the rigidity. I prefer, if you have spasm, I prefer to leave it. And then with proper posture, minimalistic, oh, it's painful, good. So you dance in this. So that by the motion, I make a reversible process. The brain recognizes, oh, these motions, or these movements, or these postures, or this load doesn't create problems. Okay, now I will reduce spasm 10% less, so that I come back to the same state. And then, if something necessary, jump in the field, check it. Do you need some slightly, very sensitive manipulation? People think that people in chiropractic are, cracking all the time. No. You use sometimes when it's necessary, but that's not often. You use more this.
What I hope our working together, cooperation, brainstorming, and so on can get to is this kind of to create an audit system for an individual, so that they can understand what is the minimum amount of things for them to change. Because sometimes you cannot. You need to show up. You need to push through. But what else can you change in order to get the result?
Well,
and I don't expect an answer now. But this is what I hope we can put together.
Okay, I'll tell you the way I work. When people comes to me and said, I have back pain, okay, good, I have the same. So, what's next? What's your profession? How many hours you sit? How many hours you sleep? What's your favorite position? What can you drive? What's your seat? What's your favorite sex pose? Huh? What's your favorite sex pose? How often do you have sex? Do you have a regular partner or you change your partners? I have several guys that go, oh, I've changed partners every day. Oh, that's why you have back pain. Why? Because something's 160, 2 meters. So you have to jump, my friend. So you're a monkey, actually. You know, doesn't matter. It's like sex with a giraffe. You know, run up to kiss, run down to. Sorry, but it's
So an audit system of complex questions that dig up the life.
Yeah. The other thing is, I said, okay, send me a picture of the way you sit on your job. But you know, when you relax, somebody took a picture from a side, and picture me from above yourself. I need to see organization of your table. So, third picture, send me a picture when you're home in a bed, and your husband take a picture of you, and you have a sport bra, and you have a sport shorts on yourself, on the side, on the back. What kind of picture you like? I said, normal picture, laying on the back, on the side, that's all. No, I'm making jokes right now. No, why? I want to see a mattress. The posture when you wear. Show me how to use pillows. And that is some other questions like that. And then usually they come with the car in the front.
Yeah.
And, okay, show me how the way you sit. And I say, okay, that's right. That's right. What? That's right. But you have other clients, no problem. I like to see now I have idea, I want to see that's right. Because if I do with you, and I tell the thing I've done with you, the other patient that was waiting for me, they will respect because I will do the same. Will you do the same? Of course. Come with the car. When? Well, let's go for coffee Saturday. Do you have your time for yourself? Yes, I do. But when I like to work, when I'm into something, Saturday, Sunday, it's a pleasure for me. I'm not the slave of my job. My job is my playground. I enjoy it.
I like the phrase.
Yeah, that's the way I work. And then send me a report. I show you the reports I work with my clients here. The answer on several questions, and I follow. Critical risk, high risk, moderate, low risk, no risk. Then I say here, no pain during exercise, good. But what was here high risk? Daily sitting, how many times spent on mobile phone? Level of nerve pain, etc. So many things. Now I see when they have a problem and days they don't have a problem. So September 26 is this, but this is September 29. Everything was high. Here was good. I want to know what you have done this September 26. Why you have such a good grades? On that day and the day before or 2 days before, you were very high. Explain what you have done. So the next time you come, you have a question like you're a professor and student, you know. I was sitting about 2 hours more. I told you, 12 minutes in a row, that's maximum for you, my friend. But you know, I was typing some codes, good, so typing explain to your pain. And the best work is, when I gave him so many advices, and I gave him my book. Here my book, read it. These are daily advices for you. And then after 1 month you come and tell me, oh, I have a pain here. And I respect everything you said. I said, that's why you have back pain. Don't tell me about that. And then the real cause emerge. Well, I was with a kid. I was a kid in the backyard, and we played some soccer. And I remember I missed a kick. Oh, wow. And after that gets past me, yeah, well, now you get the story. Because when you knock out your back, 2 or 3 days later comes the result.
Yeah.
Hello, I'm here. Hello, my baby. Dun, 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 dun. That's it.
The bill may come a little later.
Yeah.
And you mentioned that it takes about a minute to fill in that questionnaire.
Yeah, 2 minutes.
With your
2 minutes. 2
your
minutes
patients
per day.
need to spend
Yeah.
to create this kind of a report.
Yeah.
There was you mentioned you got something you want to ask, Paul?
One of the questions actually was exactly about this software that you developed, or this readiness questionnaire.
So here is, for instance, a questionnaire, and then you see high risk, you spend such amount of time. Moderate risk, no risk, low risk. So let's say this side is good for us, but this is critical risk and high risk. So I made some kind of risk scale. Maybe they're a little too strong, but I prefer to keep people in a more safe zone that let them make some kind of jumps out of the box. I like I liked very controlled situation about the backs. That's my goal. And after I said, when you pass one period that you have no pain, and you just forget how to use your body, and still don't have pain, that means that the knowledge you gain here settle in yourself, and then tell me your best wish. I want to run. Good. Okay, you may, but my conditions and my rules. You may run 50 meters. 100 meters you have to walk. Wow. No, seriously. Why? 50 meters you make your spine like this, boom, 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 and then you walk. But in that 100 meters of walk, your heart rate normalize. But no, in first 20 and 30, your heart still continue to beat even higher. Why? Because you stop running. And suddenly whole blood from your legs and muscles, body, come to heart. By running, your muscle pump on the legs start making additional heart. Now you get more higher pulse. So that's for our cardiac adaptation, and also the vascular adaptation, and also at the same time we work on the spinal adaptation. You know, when you get a story about blood pressure, that's common thing.
Yeah.
But nobody speak about blood pressure inside of the vertebral bodies.
Inside the vertebral bodies.
Sorry, what's happened with that? You have end plate fracture, and you have blood bleeding moment. What's happening with the pressure inside? You start to decrease. Sorry, buddy, that's a different story. Sometimes this pain can be also for increasing blood pressure. We don't know yet, but surgeons know when he operates. Full of blood. What the hell is this? Yeah, because small node, when it happens, it happens. He broke the end plates, and end plates, this fracture behaves like knife, and goes straight in the bone, because bone is soft. Bone is very elastic.
Well, any imaging, so an MRI with any kind of contrast will it show this?
Absolutely. And Stuart also run many good tests about that. But this is one thing.
Yeah.
And when you have spine like this one. Look at this. Intravertebral probes. So, but now this system is stable. Why? Because this part of this behaves as a hook. No motion. I tested. Try every test. Stable. Good. But it's painful when you make this and this.
In Czech Republic, in Prague, we have the Prague School of Rehabilitation. We have DNS. DNS is very popular along the chiropractic.
Tell this to my ex-wife.
Chiropractic community in United States. Chiropractors like DNS.
Yeah.
And then you have BackFitPro.
Then you have feedbacks.
Then you got feedbacks.
Yeah.
And my question is, people get results with the different systems, and what are the common things?
How do I comment actually this?
Yeah, I guess comment. I would like to hear your comments on this, and for us to be able to take something and say, oh, this is similar, this is a little bit different, and it may apply to these individuals.
Okay, so here's the story. Every client has his own therapy. For some clients, DNS is perfect. For some clients, my approach is not perfect. Probably one part demands different kind of software and engineering. Some other things like BackFitPro, I'm same and similar with Stu. Same, I use technology, but I develop something some differences exist, and that's normal. I call this months. Tomorrow my students will upgrade my approach. DNS is okay. I don't understand very well this, because the motion things that are working affects tissue in many ways. Also, for other topics, you should speak with Dr. Biomechanics, who is a world scientist and neurologist in EEG and EMG. Ask her for opinion. You will be shocked.
All right.
So that.
Should we mention your name or no?
Yeah, we mentioned, no problem. Yeah, she's ex-wife, but she is a brilliant scientist and extremely brilliant clinician in neurology. So that's one thing. But she's not willing. I know that she's not willing to give interviews, and she have her own space, and that's it. In terms of other approaches, I think that we all try to help a client in best way that we can do. But the only thing is, I try to be not blinded by my methodology, neither with somebody else. I like to learn something from you. I like to learn something from you and take something from you and take something from you. I remember Stuart came first time in Norway 2003 in Hamar, and the first sentence that he approached the stage, he said, "I'm coming here to bring you some tools that will increase knowledge in your toolbox, or add some tools for your toolbox, nothing else." And he said, "I don't have allegiance to anyone." Of course, he developed one system. I have allegiance to him. I have allegiance to some other system that I use for my system to get rich. Stuart doesn't use his system. I use. But this system belongs to the Schroth method. Katarina Schroth for scoliosis correction. I realized that this is very important from other point of view, not only for the spine. So I try to learn from everybody, even from DNS. Something that they use for awakening system, perfect, brilliant. I use that too, but this system has a limitation. Like mine have a limitation. That's why I'm using something from me, to enrich my system, try to help. But if I don't understand this, I will not say badly about things, like this and that. But why I mentioned this, a lady and approached this, because from a neurology point of view, she can give a lot of insights. That's the story.
That's good. That's very interesting. And I think that's something we're going to have to follow up on. Regarding different systems and different tools, muscle weakness. So myotomal testing is a form of isometric resisted testing.
I mean this kind of boom. Yeah.
And it is used by chiropractors and neurologists. The general interpretation of these findings that you get from them is agreed upon. However, some will use, chiropractors, for example, will use even the subtle differences in these tests, where you can test with your hand or use a dynamometer to navigate what is wrong. I wouldn't say that you're making a diagnosis with this, but you're collecting information. Now, I guess my question is this, what are your views on this? And then how can you use maybe some tools, some electronics?
That's why I switched this on.
Okay, so here we are.
Yeah, here, this is this is a spinal mouse tool that I use. But methodology they've used inside, it was based on mobility. The better mobility, the spine is more healthier. Wrong. Every spine is different. So I use this tool to realize geometry and to realize does a test that I use for spine checking correlate with these things. And then I realize that many things inside need to be changed in terms of philosophy. But tool as a tool gives you a fantastic shape of the body. It's about 98.6 precise as an X-ray from a side and from back. So you use one tool which is brilliant.
So what is it? What are we talking about? Is this some kind of sensor? Is it an imaging
let's say
tool?
it's an imaging tool and more like
mouse.
It's like a mouse here in my hands. So I draw this on the spine and I get, because the software here is perfect. But
is it using light?
No, just using the shape of the spine.
Okay.
And it's really brilliant, the idea. I'm saying this with really, it's not that I have any kind of contract with them to make a commercial of that, but it's really brilliant tool for things. But one thing you need to know how to interpret these results. Because
to also know where the spine is.
yeah, exactly. you just mentioned the right thing. So many things. Oh, we look at this. Because when I say this kind of imaging, I see some other things are problematic here. Then I see the scores here. You will see this, like score. Ideal posture score like this is 53, based on some posture is 61, harmony is 45. And then flexion. So the more flex is better. No, it's not. Because here's the problem. If we flex our spine from each joint, that doesn't mean that we are perfect. Take one lifter and take one ice skater.
Yeah.
It's totally different story. I'm not speaking about yogi guy or something like that. Ice skater, total two different spines. So different criteria has to be for a lifter, and different criteria will be for this. So I said to them, okay, make me this and make me that. And then I use basic test here, then I use my own tests, which I'm thinking, okay, what is the most posture that you hold having during the day? Is this. Good, I'll test you in this position to see what's going on when I compare with normal position. But first thing, define normal. That's the first thing, define what's normal.
Right.
And then I'm not looking at this. I'm looking at the shape here, using my test, my notes, and this is only a tool that gives me feedback for geometry.
Right.
And that's all. That's all.
So the benefit of this tool is
Yeah.
that you can put people in different spinal postures
Absolutely.
and then measure, and you immediately have a visual reference and a score.
Yeah.
It's fantastic. It sounds like a very quick process.
Yeah.